Late yesterday, the Trump administration completed a change to the Affordable Care Act, rolling back a policy that protected transgender patients from discrimination. This new policy, enacted during Pride Month, was announced on the anniversary of one of the bloodiest days in the LGBTQ community, the Pulse nightclub shooting. At the time, the shooting was the deadliest the country had ever seen. 49 innocent lives were lost. We're also learning more about the deaths of two trans women who were killed this week. Dominique Remy Fells and Rihanna Milton were killed on Tuesday. Each of their cases are considered open homicides, according to police departments in both Philadelphia and Liberty Township, Ohio. The Human Rights Campaign says that at least 14 transgender people have been killed so far this year. The majority of those are trans women of color. GLAAD, the Gay and Lesbian Alliance Against Defamation, says the trans women of color have a life expectancy in the United States of 35 years. Joining me now, Kimberly Crenshaw, professor at both UCLA and Columbia Law School, and Imara Jones, founder and creator of Translash Media. Welcome to both of you. Thank you for being with us. Imara, it's kind of unbelievable. I've read that statistic. I've read it on TV. I've seen it. 35 years. I think there's nothing more dangerous in America than being a trans woman of color.
Well, it's certainly one of the most dangerous things. I think that there's so many factors that contribute to the statistic that you gave. One of them being lack of access to healthcare, of course, lack of access to jobs. And when you have a life expectancy of 35, or the fact that most trans women who die before 35 are due to homicide or some other factor, it's because everything is failing. And so we need to look at the entire system of support and rights and equal access that we have for trans people. And of course, the new rule from the Trump administration sets us back in that.
So this is interesting, Kimberly. When Imara says everything is failing them, that sort of fits in with a philosophy that you have articulated and a term that you've given life to, intersectionality. And one definition of it, and I'm sure you have better ones, is intersectionality is the complex cumulative way in which the effects of multiple forms of discrimination, such as racism, sexism, and classism, combine, overlap, or intersect, especially in the experiences of marginalized individuals or groups. So it would stand to reason with this theory, and I got that description from the Merriam-Webster dictionary. Under this theory, a trans woman of color faces multiple forms of discrimination because they are transgender, because they are a woman, because they are a person of color, and all sorts of systems fail them.
Yes, and it's important to focus on the systemic dimension of it. I think one of the things that sometimes people misunderstand about intersectionality is they think it's just about identity. It's just an identity politics claim. It's just a demand for recognition, rather than it calls attention to the ways that transphobia, patriarchy, and misogyny and racism all come together. It's the confluence of these dynamics that cause the disproportionate vulnerability of trans women of color. It's not just one thing, and it's not just an identitarian thing. So I think, as Imara said, it's the failure of all of these things that contribute to the vulnerability, and therefore our politics have to address those confluences that create the harms that now we're seeing happening across the country.
To many people, Imara, we've sort of been able to normalize the idea that we live in this free, open society and everybody faces the same experience in life. In this moment where we are realizing that that's just not true, particularly as it relates to people of color and the police, what is the thing about the experience of being a trans woman that you can tell our audience, that the things that they may not think about on a daily basis, that trans women think about on a daily basis, the fears that they have?
Well, I want to be clear to speak to my experience. I can't speak for all trans women, but I think that one of the things that's really important to understand is that we face the backlash and the frontlash caused by living in a patriarchal society. So for some people, trans women are murdered and killed and are targeted because we are too much woman. And with respect to trans women, and then on the other hand, are also ridiculed in public culture and dehumanized for not being woman enough. And so that bind is a unique one that is faced in our society. And I think that we have to not, in our conversation about race, understand the way in which race works together, as Dr. Crenshaw has so incredibly and groundbreakingly shown us all, the way in which it is reliant upon and works with, patriarchy works with race and works with our capital and economic structures and works with our legal structures and rights. And one of the most important things to understand about trans people is that whether or not we have basic rights in this country is actually a question. It's a question right now before the Supreme Court. The Trump administration, through this rule, has deemed that our humanity is not equal, and therefore we do not deserve equal access to health care. And so that is a basic tenet of American life that is not faced by the overwhelming majority of Americans.
Kimberly, 3 months ago today, something happened that I think if you asked 10 Americans about, not most of them would know what the significance is of today, 3 months ago.
Yes, so it was the moment when Breonna Taylor, who should have been a hero, I mean, she risked her life trying to give service to her fellow Americans to fight the coronavirus. She was an EMT. She lost her life when a raid of her apartment, based on a mistaken warrant, a no-knock warrant, allowed police officers to come in and basically shoot her 8 times and took her life. Very few people knew about that at the time, and basically 3 months passed before there was any attention to it. So Breonna Taylor is the latest Black woman to lose her life to police, the latest one whose mother had to find out that the persons who were responsible for killing her were the police, but there are many others. There's the family of Kayla Moore, a transgender woman who was killed in Berkeley. There's Michelle Casso, a woman who was having mental health crises at the time, and the police killed her. We don't know their stories, and because we don't know their stories, we don't really have a full agenda of what anti-Black police violence looks like. And until we include their stories and until we include their frames, we won't have a full template from which to build reforms off of. So that's why Say Her Name is so important, to lift those stories. Say their names to tell their stories.
Well, we are just getting to the point that most Americans understand that Black Lives Matter is a thing, and a thing that they can say proudly, and a thing that they can put in their tweets, and a thing that they can wear on their shirts. So while we're at it, let's remember to say her name, and let's remember that trans lives matter, because if we can open our minds, we can open our minds to every last bit of it. Kimberly Crenshaw, thank you for that. Kimberly Crenshaw is the executive director of the African American Policy Forum. Imara, thank you for sharing your stories and the things that we need to understand about transgender people in America. Imara Jones is the founder and creator of Translash Media.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.